A very, very good morning to you. It is Sunday, the 1st of November, 2020. This is your Sunday Synthesis podcast with me, Howard Feldman, and COVID expert or non-expert, Dr. Anton Meyberg. As you can see from the background, it is Jacaranda Sunday. It's Jacaranda Sunday because we've determined that it is so. If you go outside in Johannesburg, I imagine, in Pretoria as well, you will be assaulted in a very, very positive way by the magnificent colors that the jacaranda trees are showing us. It is really, really beautiful. It is spectacular outside. And as much as COVID still exists in the world of a pandemic, there are also other beautiful things that we do need to focus on. Dr. Anton Meyberg, as always, a very good morning to you. How has your week been?
Good morning. The week hasn't been too bad, thank God. The numbers have come down quite dramatically. There are currently 46,425,070 cases worldwide, with 1.2 million deaths and 33.5 million cases resolved. The United States has 9.4 million cases with 236,000 deaths, and South Africa has 725,452 cases with 19,276 deaths. There have been 654,182 recoveries, showing a 90% recovery rate. There were 1,770 new cases in the last 24 hours, of which 22,150 tests were done. There are currently 2,013 cases of COVID-19 in Gauteng, with 176 in ICU and 85 currently ventilated. As we all know, the United Kingdom is going on lockdown for the next 4 weeks. Other countries to follow suit are France and potentially Spain. We cannot afford to have another lockdown in our country. It will be devastating from an economic point of view, from a medical point of view, and from a mental point of view.
So let's just take us through that. We've seen Israel's coming out of a lockdown, in fact, today or yesterday. These other countries going into lockdown. Is it like almost these sort of almost like a power nap, where they the numbers increase, they have these quick, sharp, or maybe it's not quick because the UK is going into lockdown next Thursday until the beginning of December. It's very, very concerning.
So I think we've got to ask ourselves, why is the UK going into lockdown, and why is it good for them to go into lockdown, and why is it bad for us to go into another lockdown? And the reason is as follows. If you go into lockdown, you have to have the facility to be able to test as many people as you need to test. You have to be able to put people in quarantine. You have to isolate people, and you've got to be doing contact tracing. At the same time, you've got to sustain your economy. If you can fulfill all those criteria, then you can go into another lockdown. If you can't, then you're looking for major trouble and major socioeconomic troubles coming forward.
There was a lot of rumor in the last week or so about South Africa going back to level 3. The president denied it completely. He said it was absolute nonsense. Then in the meantime, he came into contact with somebody who was COVID positive. Clearly the tracing isn't working as well as we would have hoped it was working. But nevertheless, that seems to have been a bit of misinformation or fake news.
Rumor mongering. Yeah, as we know, there's a lot of people that have been talking about it. If we look around, we see Dr. Zweli Mkhize was positive. The president was in contact. But at the same time, Dr. Mkhize didn't come out and say, this is a rubbish virus. It's done nothing. I'm not worried about it. He still came out strong, saying, keep your masks on, wash your hands, social distancing. We can beat this virus. Very much different to Trump, the way he came out of the virus, basically trying to shoo the virus away.
Yeah, and in fact, I think that it's an aside, but I do think that did him damage, because all he needed to say was show us a little bit of vulnerability. It is scary. It has to be scary. When you give somebody the news that they are COVID positive, what is the reaction? I'm sure there must be a tremendous amount of fear.
So there's a high level of anxiety related to it. Once again, there's always a stigma related to it, which there shouldn't be, but there is. And there's anxiety, there's stress. The people are very knowledgeable today compared to many years ago. Today, hundreds of years ago was the bubonic plague, which came out in London, in the UK, and over 50 million people died from that. And if you compare the two types of plagues, then we had no social sort of education. People didn't know what to expect. Here, people know what to expect, what's coming towards them, how to react. And therefore, there's definitely the sense of nervousness, of anxiety, and a sense of trepidation. So when you tell somebody, there's a fear initially, but then essentially if they behave and they're able to fight the virus well, they get over it very well and manage to go forward.
Yeah, and let's just talk very quickly to our recovery rates, to our mortality rates. How are we doing here in South Africa? And I don't want you to address yet the issues of the long-term impact that we're seeing or not seeing. Let's just talk about classic recovery and mortality.
Look, the recovery rates are good at the moment. You know, the overall recovery rate in the country is 90%. The mortality rate is low. It's only 19,000, which is dramatically low. And we've got to ask ourselves, why is the mortality rate so low in this country? And there's been lots of talks by Shabir Mahdi saying that potentially in the highly densely populated areas, a lot more people got the virus that were cohabiting together, and now they've developed immunity. We don't have a herd immunity yet, but this might be a positive step forwards, that if we do get a second wave towards the end of the year or beginning of next year, that those people who were in the highly densely populated areas who may have got the virus won't get as sick as they would have now. It will be people who basically didn't get sick, or people who weren't exposed, that will be exposed if a second wave does come. And I'm saying if a second wave does come. Just because it's happening overseas doesn't mean it's going to happen the same way here. But if we follow international trends, we're now in the warmer months. You know, if you look overseas in Spain and anywhere in Europe, when they went to the warmer months, they basically decimated the virus, they got rid of it, and now as they're going back into winter, it's resurged, they're having a second wave. So we're hoping that we're not going to go into a second wave. One of our big worries is international travel in December and January. When people come from overseas and are not going to quarantine, they will spread the virus all over the country.
How effective is this? A lot of countries, or South Africa demands from a lot of countries that you have to have a negative COVID test. I would imagine that goes some way to
Look, it definitely does go somewhere. It's got to be 72 hours within you landing at the airport, if you land at OR Tambo, wherever you land. But that doesn't account for saying that when you're at the airport overseas, or you're on the plane, that you can catch it from somebody else and then spread it. So it's not 100% fail-proof, and that's why you've got to quarantine when you come from overseas. There's no doubt about it.
Right. So it's actually a lot of questions around that. And a lot of questions around how to deal with people, for example, grandparents that we haven't seen for a while. Before we go to that, can we please get an update on the vaccine? I know Israel is starting trials. I believe it's today. What is the hope for the vaccine? Because I read an article that said, no, it won't eradicate it, but it'll reduce symptoms if you get it. I'm a bit confused by it. Can you take me through that?
Let's take it back a step.
Yeah.
When you have the flu vaccine, does it eradicate the virus, or does it decrease the symptoms of the virus? And the answer is, it decreases the symptoms of the virus. It doesn't eradicate the virus. It's not like the polio vaccine, which has eradicated polio. So now, if we go to, according to Dr. Anton Fauci, he says that the first safe and effective vaccine will come out at the end of December, beginning of January, and that's according to the tests they've done. They've passed the phase 3 trials, they're going into phase 4 trials. That's companies like Moderna, like Pfizer, all of those, the Oxford, all of those ones. Right. And we must remember that the concentration of antibodies in our blood does not equal the immunity. There are many complexities of how the body can build immunity to infections. And immunity basically is about the body system, how it works to combat the infection. So if the time you're exposed to infection, you want to get immunity, you basically get seriously ill, and then your body develops antibodies to try and prevent you from getting sick again. According to Dr. Fauci, he said that the initial Corona-19 vaccine will prevent, as you said, symptoms in those people that have been infected with the coronavirus rather than actually kill the virus. And that's the primary endpoint of this vaccine, is to prevent people from getting critically or severely ill if they become infected. The secondary endpoint is getting rid of the virus. And that, as you say, is a secondary endpoint, very much like the polio vaccine. But the antibody response is generally a short-lived response. And we can't sort of hedge all our bets on the antibody response. We've got to remember that you develop memory cells, which from the T lymphocytes and the B lymphocytes, that are going to play some role in your fighting of this virus. So that down the line, if you get the virus, you hope that these memory cells will be able to attack this virus if it comes back, and that will be through a vaccine or through previous infection, and will prevent you from getting critically or severely ill.
When do you hope that South Africa will start receiving the vaccine, that we can start rolling it out here?
I can't see us getting it before at least March next year. If it's only coming out December, January in the States, by the time it gets backlogged, by the time it gets produced, unless you start producing it in this country from a credible source overseas, it's going to be very difficult to get it here before March if it comes out in January.
Right. Which
and
we would
also
hope.
They have overseas in the Northern Hemisphere, it's winter, so they've got a higher need for it. If we're in our warmer months, and remember, because of the warmer months, we're outside, we're a lot more socially distanced. In South Africa, we've got bigger areas to go outside and to basically assemble and commune together, whereas overseas they don't. In the winter months, they're going to need it more than we are initially, so it'll be sort of postmarked for the Northern Hemisphere to start.
Right. And do we have any sense as to how long the vaccine will provide some form of immunity?
Well, that's the age-old question. We don't know yet, and that's what part of the tests will show. Until they actually tested on the people overseas, and maybe we're lucky in the Southern Hemisphere because the Northern Hemisphere can be sort of our test population. Then we'll only get answers then. We don't know exactly how long even the influenza vaccine gives us definitive protection. But we do know when you've had it, you do get less sick. Everyone always complains that they'd had the vaccine for flu, but they still got sick. And that's normal. We do still expect you to get sick because, as you said, it doesn't eradicate the virus. It decreases the symptoms and contagiousness of the actual virus.
Are we seeing people getting sick again? I know we spoke some weeks ago about a case here and a case there, but surely if people were to be getting sick, we would have seen, we would have seen a lot more cases.
So I think you've got to remember that there's still 1,770 cases in the last 24 hours. So because we're not seeing it in our community where we are at the moment, doesn't mean it's not happening. And they did 22,000 tests in the last 24 hours. So they are testing. So we are seeing people getting sick, but the hospital numbers are down, and that's attributed to the warmer climate, and that's attributed to people actually going outside more. And it has to be attributed to the non-pharmaceutical interventions. Although people are getting complacent, and although people are lax, there's still a majority of people that are using masks and are washing hands and are social distancing, and that is the major preventative measure we have at the moment.
All right, the question I actually asked, I'm happy you answered that because I was going to ask this anyway, but the question I was actually asking was referring to people getting reoccurrences, people getting sick again after having been through the virus, having been sick.
So there was a report of a doctor in Cape Town having had a resurgence of the virus. I'm not entirely convinced about that in South Africa. I don't believe we've had a resurgence of the same virus in people in South Africa at present, because what happens is when you get the virus, they take the strain and they can look at it at the NICD. And then if you get it a second time, a number of months later, they take that same virus or the virus that you now present with, and they can compare the two. And they haven't come up with any concrete answers to say that it's a different virus or it's a new virus that you've got again. It's most likely the same thing. It's just been continuing, and there's viral shedding in your system.
Okay, before I get on to some of the questions, the one thing that I'm starting to hear more and more of is the symptoms that people are suffering from. We spoke about it a little bit last week. What are you seeing in terms of this enduring, whether it's fatigue, breathing issues, etc.? What are you seeing in your practice?
So obviously in respiratory practice, you generally see more of the people coming complaining of the respiratory pathology. A lot of people have got shortness of breath. A lot of people are still coughing. The biggest symptom we're seeing at the moment is fatigue. People are complaining of tiredness. And one of the other major things is people complain of a brain fog. Maybe you've had COVID.
It could be. I think I've had it for years.
Yeah. So this brain fog they speak about is that they just can't remember things like they used to a few months ago.
Yeah, I don't even know the question. What were we talking about?
Exactly. And there's definitely some neurological sort of interaction with the virus affecting your brain and your cerebellar area and your whole cerebrum. And there's definitely something to it. So the main features we're seeing are respiratory, from a shortness of breath and cough, fatigue, definitely. There's no doubt about it. And there's brain fog.
All right, let's talk about the elderly in our community. Khani Bukat says, we want to go on holiday and stay with our grandparents. Should we quarantine before we go? And if so, how long should we quarantine for?
So I think you also got to look into the fact, do your grandparents have comorbidities? Are they well people? Are they interacting? Are they going out? Are they working? It's a very important thing. I think in an ideal world, the answer is yes, you should quarantine before you go on holiday with them. You should test before you go on holiday with them. Then you'll know. But then when you do go on holiday with them, you've got to stay with them as a unit and as a bubble. You can't sort of then go to your friend's house and then go somewhere else. If you're with them as a unit, and you one family then, but it doesn't help to have other interactions with other people without masks, because then you can still introduce other infections and you can potentially introduce the virus towards them.
It's practically very hard.
It is very hard, but it is doable. It is very doable.
Leanne says, my husband would like us to spend Shabbat the weekend with his parents in Edenvale. We are immigrating in a few months. Would it be okay for us to stay with my in-laws, or should we rather stay in accommodation alone and just go to them for meals?
Look, it depends. Do they have a big house? If it's a small house and, there's no good ventilation and you can't sort of stay a decent space away from each other, then it's not a good idea. But if they've got a very big house and you can go to one side of the house, they can go to the other side of the house, you can sleep there. And then when you have your meals, you socially distance outside with more than 1.5 meters, then it's something that you can do.
So I think that the answer to a lot of these questions is just recognizing that we have a human need, and we can't survive either without connection, especially to our parents and grandparents, etc. And we've just got to find the best way to be able to achieve that.
Look, I think that's correct. But remember, we're in level 1 lockdown. The infections and the contagions of the infections aren't as heavy as they were 2 months ago. And that's why it's okay to do these things under the correct sort of ways of doing them, because, now's your time to do it if you do it properly, because who knows what will happen in December, January, February. We don't know. We don't have the answer to that. But if you can do it
January is 2021. So there's not going to be COVID.
Thank God.
I think you need to go back to your medical journals. This is a 2020 thing.
No, it's a COVID-19, so it should be over already.
Yeah, there's that. All right,
yes, I think we just got to do things responsibly. Just do it responsibly, 100%. Do it carefully, and you can do a lot more than you thought you could have done 2 months ago. Right. But just do it safely.
And I think the other thing that's important that you're saying is there's an opportunity now, because we're not in a second surge. Hopefully we won't even get to it. But at this stage, there's a little bit more leniency in terms of being practical and seeing people. We might get to a stage by January, February that we go into.
I think I've got to stop you there. I think the word leniency is important, but leniency doesn't equal stupidity. So don't be stupid if you're lenient.
I didn't say it wasn't me.
I'm looking at you. There's only one person I can see here. Right. So I'm saying don't be stupid if you are with people. Don't take off your masks. Don't socially interact unnecessarily. Just follow the rules. That's all we need. We all want to go on holiday. We all want our kids to go back to school after the holidays. We just got to follow the rules.
Aviva raises a very, very important question, and it's one that I know that a lot of us have been trying to figure out a way around. Old age home residents are heading towards a mental health crisis, being locked up or locked down for 8 months now. Please advise how to safely reintegrate them back into some form of normality, obviously still observing the basic corona protocols.
Yeah, that's a very loaded or tough question, should I say, because there's no easy answer. And I can only speak with my experience with the Geverkdische/Sandringham Gardens, because I've got a lot of experience with that old age home. But the reality is the vast majority of the old aged homes, the people inside them are very happy with the lockdown, because they realize that they are the most vulnerable population in this pandemic. Majority of families understand this. And I'm not saying it's easy, because if, God forbid, you lose a loved one and you've got another loved one in the home, how do you interact with them? How do you console them? How do you give them emotional support? So it's not easy by no means. But if we're looking at the mental health and we're looking at the anxiety, it just takes one super spreader to cause a dramatic spread of cases in the old age home. And then we will know what mental anxiety is. Because the fatality rate in the old age homes, and I'm not talking about the Sandringham Gardens, I'm talking about other old age homes, is 3 to 4 times that of Sandringham Gardens. You know, in Sandringham Gardens, the residents are looked after, they eat together, they have activities together, they're in a bubble together, and they're protected so well. Their mental health is being looked after in so many aspects. They're allowed to have video calls, they're allowed to have COVID-safe visitation.
Yeah, I was just going to say, they definitely are having COVID-safe.
But it's all COVID-safe. It's COVID-safe visitation. And none of these rules are being made without Sandringham Gardens discussing it with the right personnel, the right authorities, the medical personnel, and they're doing it in accordance with international trends. So everything is being done safely. And we have to just remember that these are our most vulnerable population. We have to keep them safe. And if we have to keep them locked up, even in this environment, we have to do it. And it's not easy. And it's an emotional nightmare for us, but less so for them because they've got the support of all the people around them.
Another conversation I had with somebody yesterday was, I mean, this is talking about older people, but there are a lot of our kids are battling, that there are real emotional challenges that our teenagers, and I'm not talking about now the young kids, I'm talking about teenagers from the age of, 14, 15, up to early 20s, where a lot of their social lives have been curtailed. They've got out of a routine. They can't let off steam, so to speak. It's a very, very difficult, it's been a very difficult year for them.
You know, it's been a terrible year. And that's why us as parents, we've got to be aware of these things. We've got to look out for the signs in our children to see, are they depressed? Are they not coping? We've got to support them. We've got to try our best to support them, despite the fact that we're all going through it. But you've got to have an extra strength for your children to support them through this time, because there's a high instance of depression. There's a high instance of parasuicide. There's a high instance of drug abuse. And we've got to try and stop this. Because we've got to remember that you're taking social, popular kids who interact with each other all the time, and you're basically squashing that, and you're not allowing to do what's normal to them. They're not having the same types of matric dances. They're not allowed to go on camp. They're not allowed to have sleepovers. They're not allowed to go here. They're not allowed to do this. There's just no. That's all they hear all the time. So we've got to support them with yes.
Right, as much as you are able to.
As much as you can in the realms of the whole pandemic.
There was 1 or 2 questions around sleepaway camp. Are any of the camps happening, and should they be?
Well, they are happening, but they're not having sleepaways. None of them are having sleepaways. It's not safe. And if they are having sleepaways, then I wouldn't send my own kids to that type of thing, you know. And even if they are having day camps, it will be done within the rules of COVID.
So let's just stop there, because there were a couple of questions about some camps that are having sleepaways. They didn't mention the name of the camp, and nor do we don't need to do that here. No. But your view is, if there is a sleepaway camp, you would not send a child there, but if there's a day camp... How are you going to contain it
with your own children? How do you contain it if they're sleeping in the same rooms, taking off their masks? It's impossible to contain sleepaways on a camp environment when children get into this euphoric state and they just want to be kids again and they just want to run around and play together. You cannot contain it. It is uncontainable. And a lot of the second waves overseas have been from younger kids, 18 to 22-year-olds, who cohabit together, who have parties together, and that's how the spread happens. So I don't think it's a good idea.
All right, so you wouldn't support that, because that's a couple of people asking around that, and just going back to holidays, go on holiday, but create your environment, I would imagine, around your family that you can be safe, but absolutely go and have a break. It's critical to do it, because I think mental health, if we don't do this, I think we're all going to be in trouble as a society.
I think it's mandatory. If you can afford to go on holiday, go for it, do it, but just do it safely. As I said last week, when you cross the border, it doesn't mean that there's no more COVID. More so because there's going to be a higher concentration of people together in the different areas, you've got to be more careful, and you've got to wear your mask, and you've got to be very careful on the beaches, and you've got to be very careful in shopping centers, etc. But it can be done. We can all do this, just as long as we do it properly.
Is there good news?
So there actually is good news. Good. In the hospital where I'm working at the moment, Linksfield Hospital, there are currently no cases of COVID. as of time of going to press. 0 case of COVID for the first time in 8 months. Caution, mask wearing, social distancing, these things are saving lives. There's also 2 new COVID-19 antibody treatments that have been developed by Eli Lilly and Regeneron that have shown major promise in reducing viral load and decreasing hospital stay. And of course, Liverpool won a game last night again. They hammered their opposition. They have now tied the record for 63 unbeaten home games. And my final quote is, a push will get a person almost anywhere, except through a door marked pull. Be safe, be well, and look after yourselves.
Dr. Anton Meyberg, thank you. As always, this has been the Synthesis Sunday podcast. It's the Jacaranda edition, which means that you are now obligated to get outside, go for a walk, and go and look at the magnificence of nature, that nature has bestowed upon us. If you're in Johannesburg or you're in Pretoria, it is absolutely criminal if you don't go and do this. It is beautiful out there. Get some fresh air. It's the safest way to do it. And just make sure that you look after your own mental health as well as those around you. Have a great Sunday. Be safe. We'll chat to you next week. I'm Howard Feldman for the Synthesis Podcast.